If your sample of choice for performing Diff quick procedure is blood, you're going to obtain your blood, of course, in a vagina like this. You're going to mix it gently to provide an equal distribution of the cells and avoid shaking it vigorously because you will lyse these blood cells and you really want to see their morphology. The primary reason is to see the morphological appearance of the cells so that you can actually identify other abnormalities in this cell. Your slide, you can turn this, then you have your cover. So others can choose to use a cover slip, or you can choose to use what they call slide to slide method, where you have your blood sample here, which is now in this case you can you can handle it like this. Then of course you can make your slight adjustment down so you can check. Then you make, so it gives you the characteristics of the blood of your thin film that as you see here. So you can now allow this to air dry. So in our practical session, I'm taking you through the Diff quick procedure. So in this Diff quick procedure, you realize there are majorly three reagents that are required, or of course, inclusion of your distilled water for, of course, rinsing after. So now you see here we have our absolute methanol 100%. Others can use 95, but I have chosen to use absolute methanol 100%. And I've got our eosine, then I've got the methylene blue and the distilled water. With already prepared slide that you already have here, of course, the patient slide already prepared. So with this one, we are now going to do the staining procedure. So we are going to open our reagents. Why do you need to cover them? Covering them avoids deterioration of your reagent when you're going to be using it. Majorly, our absolute methanol. When you keep it open, it's going to evaporate and it will deteriorate in its quality of work. So, majorly, we use this as this methylene, this absolute methanol as our fixative. And what is the advantage of fixation? The advantage of fixation here means these cells that you have on your slide will actually be fixed onto the slide. That is one. Two, it also avoids washing off those slides. Then also it provides good interaction between the reagent and the cells that you are suspecting to have in your slide. So in this case, you're going to dip it into your methylene alcohol or methyl alcohol. We can call it absolute alcohol, 100%, 5 times per 1 second interval, just like you see. 1, 2, 3, 4, 5. And blot off the excess reagent from the brim of this coupling jar. Then you move to the eosine also. 1, 2, 3, 4, 5. Blot the excess of methylene blue. 1, 2, 3, 4, 5. After, of course, you're still going to remove the excess. Then you're going to rinse off the excess stain using your distilled water. So you're going to rinse both sides, behind the slide and the front side of the slide. During this rinsing process, what I should let you know is when you're going to direct your water towards your slide, make sure you direct from the top side. It should not touch where your cells are in particular. You're going to put it from the top side, and the water just comes flowing through your cells gently, just like you see. After everything is done, you're going to now to make your slide stand like this. You're going to make it stand on the rack in order to allow excess water to go off and to allow it to air dry once more. before you do a microscopic examination. Thank you.